好，现在是7点，我们开始吧。
Okay.
Good evening, everyone. I'm very happy to see you all on this Friday evening. 大家好，我们又见面了。相信大家已经知道，我们是一群volunteers。去年我们聚集在一起，为了给我们的community 做一些事情。我们觉得呢，有一个 organization 比较方便一些，所以呢，我们就建立了这个 Cheshire 多元文化协会。大家知道，我们已经举办过4次 seminars， 今天将会是第5次。今天的题目将是怎么样预防医疗的诈骗和错误和纠纷，这是一个我们在生活中可能很难避免的一个问题。这个呢是本来今天呢是一个对于我们以往的一些关于 Medicare 的一些讨论呢做一些进一步的问题和问题回答。但是我们觉得呢这个题目这个关于这个预防 Medicare fraud 和这个 error 的这个问题呢也是非常重要的，所以我们把它特别提出来。我们很荣幸的请到了 Audrey Cole， 他是一位Connecticut SMP 的一个负责人。SMP stands for Senior Medical Patrol， 是一个专门处理这样一些医疗的纠纷和诈骗的一个组织，它保护我们所有的参与 Medicare 的人士。We are very honored to have Audrey Cole from Connecticut SMP. Today's seminar will be the 4th about Medicare, but we will first focus on this very important and exciting subject, I would say. Now, without further delay, let's welcome Audrey Cole. It's all yours.
Thank you for that introduction. My name is Audrey Cole. I'm in charge of the Senior Medicare Patrol Program at the Western Connecticut Area Agency on Aging.
这是Audrey Cole 女士，她是康州Area Agency 的下属的SMP Senior Medicare Patrol 这个机构的负责人调解员。
Senior Medicare Patrol is a federal program. This chart shows you that we work under the Department of Health and Human Services with SHIP also, which you've learned an awful lot about in past presentations.
这个 SMP 这个机构是在美国卫生和公共服务部门以下的下属的一个机构。
86% of our funding comes from the federal government at my agency, 11% from the state, and 3% from private funds. Now, this is from the Western Connecticut Area Agency on Funding. And the reason I'm telling you this is at the end, we ask people if they have the time to complete an important survey, because we're asking people to comment on how we are spending your federal dollars on these important programs.
OK， 那现在这个pie chart 呢是 就是他告诉你，他60%的资金是从联邦政府得到的，然后11%的资金是从州的政府得到，然后3%是个人的捐款。他给大家看这个资金来源的原因之一呢是他在这个讲座结束之前他会发一个调查表，就是在这个 Zoom 里头一个调查表，大家就可以随手就可以填一下，然后这个会有助于这个政府去给他们提供更多的支持。
So in blue is our agency. There are 5 in the state of Connecticut, and I operate out of the Western region, which is the 41 towns.
OK，这个 SM 在康州是大概有5个小分部，然后它呢它是管理这个康州西部的大概41个小镇的这个SMP 的活动。
So what is Senior Medicare Patrol? We help prevent Medicare beneficiaries and families prevent, detect, and report healthcare fraud, errors, and abuse.
这个 Senior Medicare Patrol 的是什么？是一个什么样的一个组织呢？他们这个组织的主要是为了帮助Medicare 的这个受益人和受益的家庭去防止和就是甄别，还有报告就是健康的就是 healthcare 的这个那个欺诈，或者说有错误和任何这个abuse。
And remember, people on Medicare are not just over 65. There are tens of thousands of people who are between 18 and 64 who are disabled, who are also on Medicare.
Can you repeat that? I'm sorry.
Yeah, the disabled people in Connecticut, if you have a disability and you're between 18 and 65, you can also be on Medicare. So it's just not, people don't understand. They think it's just people over 65, but it's many, many more people may be on Medicare.
OK， 说这个 Medicare 的这个计划是你不一定要够一定年龄你才可以使用这个计划，有很多其他的因素，你也可以在不到65岁的时候，你也可以使用这个 Medicare 的这个帮助。
What we do is we're trying to strengthen the program. That's why my Senior Medicare Patrol exists. Cost recovery and avoidance, of draining the Medicare system.
这个 SMP 的这个存在，主要是为了帮助这个 Medicare 的这个 program， 去进行成本管理，还有对一些浪费的一些规避。
And we rely on a team of volunteers to perform our education, outreach, and counseling. And Li Peng is one of our volunteers.
那这个组织是除了有自己的员工以外，他们还很倚重去有很多这个义工去帮助他们。那丽萍呢，就是他们这个组织的义工之一。
We have a website that people can go to educate themselves and learn about the latest scams.
OK， 在他们的网站上呢，它专门有一些页面，就是在他们的 homepage 上面，专门有一个页面，就是你可以就是找到更多的有关怎么样得到州里的一些帮助和 一些这个欺诈的这个方式的一些信息。
Now I'm going to give you some examples. These are called imposter scams. People saying that they're from the IRS, from Medicare or Social Security, will call you or text you, and they are not. They are representing a government agency, and this is a very dangerous common scam.
其中一个很常见的一个欺骗的这个一个办法呢，是他们冒充是政府的官员或者是政府的这个行政人员去对用户进行欺骗。
Never respond to these. Hang up and call us and report it if someone attempts to contact you saying they represent one of these agencies.
你们如果要是接到冒名这些机构的电话的时候，你们一定不要去理他们，然后向SMP 去报告。
People receive these postcards in the mail. They're bombarded. They get many of them. They think they're from Medicare. They are not. They're from private insurance companies.
他们就是会有很多这种小的明信片，然后发到你的信箱里，然后这些都不是这个 Medicare 的这些机构发的，这很多都是假的。
This is very misleading. They want to sell you an insurance plan, a private insurance plan.
而这个就是非常误导，会误导你去买一些这个不必要的保险的一些 program。
It's very important when we have cases that people understand the difference between original Medicare and the private Medicare Advantage plans.
OK， 这非常重要的一点呢，就是让大家是需要搞清楚这个它原有的就是联邦政府的这个 Medicare 这个计划和这个私人的一些 Medicare 的计划。
People are very confused. Many times they think they're on original traditional Medicare and they have a private insurance plan.
很多人就是会误解，就是他们以为自己在政府的这个 Medicare 的计划里头，但是呢，实际上他们是在私人的一个 Medicare 计划。
When confused, call a choices counselor or call my program, and we will assist and help.
OK， 如果要是你们自己认为自己对这个有点糊涂的话呢，那就是 call 它有一个 choices， 这个有一个帮助热线，然后或者是打给这个 SMP。
The government will not text and ask you to click a link, provide and ask you for your Medicare Social Security number, or ask you to provide financial information. They will never call you or text you for this, ever.
OK， 政府呢就是永远不会给大家发短信，让你去按一个链接，说让你提供自己的 Medicare 或者是你自己的这个 Social Security 的号码，社会安全号码，也不会让你去提供你的任何就是经济信息。
Telehealth fraud is now common when a doctor gives you a prescription or a medical equipment over the internet or over the phone. Always make sure it is a provider who you know. Never, ever do it with an unknown provider or doctor.
那现在这个有好多是一些健康就是有关 health 的健康的这个器械或者是药，现在好多在网上是可以网购，或者是电话这个邮寄，永远去就是说不要去轻信，你永远只从自己所知道的这些公司去购买这些东西。
We educate people how to read their Medicare notices. Once you have a service, you see a doctor, you will get a verification telling you what you received. We have to look at those to detect if there's been an error in a bill or a fraud. So this is very important. And we go out in group outreach and we educate people how to read these forms. They can be very difficult and complicated. And we've saved people an awful lot of money by educating people. And we've even had people get money back that they shouldn't have paid because these forms indicated that was improper billing.
OK, SMP 呢会帮助就是向他们就是提出要求的人会帮助他们去分析你收到的这个 Medicare 的一些就是 list， 就是一个就是类似 bill 的这么一个就是类似账单的这么一个东西，然后他们会告诉你哪些东西是你不应该付的，哪些东西是你应该付的，他们会给你解释，然后会帮助你把钱追回来。
Open enrollment, this is marketing fraud. I showed you earlier where there are situations where insurance agents, especially during the October, December open enrollment, will try and trick you into speaking to them by knocking on your door and doing certain things they should not do. We educate people about marketing fraud and how to report it to us so we can in turn report it to Washington that this is occurring.
在每年这个 Medicare 开始就是开放他们登记的时候呢就会有这些就是这种广告式的一些材料。你可能会收到这些，他们就是说，他说啊，你来通过我们来登记，他们呢那个实际上他们就是想要你的 information， 然后等于是把你给骗到他们的这个 program 里头。
Avoid clicking. This is very important when it comes to the types of cyber security. Do not ever reveal any personal information where you did not instigate it. You weren't the original person. If someone tries to contact you through the internet or through the phone, do not respond. If you initiated the call, then you're in a safe area. But when you get these cold contacts, you have to verify. When in doubt, don't engage and call us, and we'll research it on your behalf.
OK， 你可能会在 email 里头会收到很多就是向你推销的这些人或者是 email， 那他们的建议就是你们一定不要去回应这些 email， 也不要去点击它里面的链接。如果你对这些东西不是特别熟悉的话，你就可以找他们，他们会帮助你去做一些调研，这样的话就是你避免上当。
Tips to prevent your Medicare number: never ever give it out. Treat it like your Social Security number. Contact us to learn more about how to protect yourself. Always be skeptical. Ask questions. Trust your better judgment.
你这个 Medicare 的这个你的这个号码千万不要给别人，这个就跟你自己的社会安全号码是一样的， 一定不能跟别人分享这个信息，这个信息是你唯一的一个对，就是在 Medicare 这个系统里头是你唯一的一个号码。
This is my program, and Li Peng has done some of it already. It's my training program. Volunteers, it's all types of participation. Some people just hand out information. Some people can be counselors, but I include this so people can see all different types of participation in the program.
这是 SMP， 你想去做义工的话，它有不同的功能，你可以去参加不同的形式，你可以去参加啊。这个就是是他们的就是可以给你提供的一些机会，对于他们的这些服务有更多的熟悉。
And I'm going to end with this survey. I'm going to put it in the chat, this link. If anybody wants to come and comment on our presentation tonight with Paola and myself, we'll have it in the chat that people can respond. And I also told Li Peng I put a half-hour Office of Inspector General with the Department of Health and Human Services. There's a half-hour Mandarin presentation explaining in detail more about my program and also about the SHIP counseling program also. So thank you very much. And this was wonderful, a delight for all the participants here.
OK， 然后最后呢，它就是有这么一个就是一个调查，这个算是一个投票的一个机制，就是让你帮他去填一下，对他这个 training 和这个 program 的一些看法，大家有机会就给填一下，他会把这个放在这个 chat， 就是咱们的这个 chat 对话窗里头，他现在好像是不是已经那个反正最后我们也会放在我们的这个link 里头。
Okay, and we can save questions for after when Paola talks, if anybody wants, or if someone has a question they want to answer right now.
现在大家有没有问题？就是对 Audrey 直接对他的 presentation 有没有什么问题？
I see the chat. Does SMP help on medical bill disputes? Absolutely. Yes.
就是这个问题之一就是，如果你的账单它有一些这个错误，你需要跟他们去纠正的话，他们这个 SMP 会不会帮助他们？他说肯定会帮助，这个没有问题。
But usually it has to be related to Medicare. But if it's not, we still will refer you to, if it's not related to Medicare, we will try and get you to someone who can help you. But it's called Senior Medicare Patrol. So it usually has to be related to Medicare for me to actually work in great detail on a case.
那就是所有他们的帮助他们只能帮助到这个 Medicare 这个 program， 其他的呢他们可以给你们指导到其他的有能力帮助其他方面的机构。
I guess Paola's up next.
Yes, I believe so. Let me just pull up my screen.
I just wanted to thank you for translating. You did a wonderful job.
Thank you, Audrey. Thank you for your wonderful presentation. We may have more questions to ask at a later time of today's presentation. And now let's have Paula 大家一定记得 Paula， 他已经给我们讲过好几次的这个Medicare 的这个话题。现在呢，我们知道呢，他有在这个原来这个机构里头呢有一个新的位置，他呢很愿意跟大家分享他现在的情况。Okay, Paula, tell us about it.
Good evening, everybody. I hope everybody's doing well. My name is Paola Vargas, and I work with Audrey at the Western Connecticut Area Agency on Aging. Thank you guys for having me here. So today I'm going to be talking to you about my transition. So I've been doing these presentations for a couple of months as a choices counselor, so helping people with their health insurance questions and concerns. And I started as of 2 weeks ago a new position here at the Area Agency on Aging called Service Navigator.
大家好，Paula 呢之前是 Western Connecticut 西康州的这个 Choices 咨询员在2周之前呢，他更换到了一个叫服务引导员的位置。接下来呢，他会给大家介绍这个他的工作的主要内容。
So at the Western Connecticut Area Agency on Aging, we have a myriad of different programs. I have a little chart up here, and we'll discuss what those programs are. We have Choices that helps people with their health insurance questions, Senior Medicare Patrol, which Audrey helps people with their questions about Medicare fraud or scams. We also have a plethora of services programs like Meals on Wheels, which delivers food to homebound seniors, National Family Caregiver Program. It provides respite to those who take care of their parents, and the Connecticut Home Care Program for Elders, which provides home health services inside the home for older adults. As the service navigator, I'm supposed to help people navigate through our services and the services that are provided by the state of Connecticut.
Paula 的主要介绍了他在美国这个西康州地区老龄机构呢，他这个机构的服务主要覆盖于关于社区之间的推荐，以及还有和州政府各个部门的合作，以及还有包括给家庭里有这个主要负责照顾老幼弱主要这个家庭服务的提供人的一些帮助。
So the Service Navigator position is a grant-funded position through the American Rescue Funding Act. And the funding was accepted and approved for the beginning of March of 2022. And it's expected to run through September of 2024. So it's a 2-year pilot program right now. And it's designed to help callers who are calling into the agency when they have different needs and questions and concerns. Each area agency on aging also applied for this grant. So I am one of 5 service navigators. So if you live in Cheshire, you can call me with questions about home care program, Meals on Wheels, questions about resources. But if maybe you have a family member or a friend who lives in Stamford, I can make a referral to the service navigator down in the Southwest region.
这个服务引导员的职位呢，是由美国救援方案法来资助的。这个资助呢是从2022年开始并将资助到2024年的9月30日，所以这是一个2年的一个现在试推行的一个项目。那么这个职位呢他 Paula 主要工作旨在帮助有一系列需求的向他们致电的人。那么这个职位呢在康州各个老龄机构计划的这个分部都有。如果您是一个 Cheshire 的居民，那么 Paula 可以直接回答你的问题。但是如果你要是来自于一个他们的机构不涵盖的这么一个区域，比如说你来自 Stanford 呢，那么你也可以同样向他咨询，然后他会向你推荐他的同事负责您这个区域的同事来回答你的问题。
So I'm just going to go over what my time will be split doing. So as a service navigator, I'm going to be helping older adults and their family or caregivers with application assistance. So that's either applying for Medicaid, both in the community, which is Husky C, or Medicaid for long-term care in a nursing facility, whether it's applying for housing, maybe energy assistance. I'm going to be able to help you do that. We could set down an appointment. We can go through a list of what you would need to fill out the application to completion. I will also be doing case management. So I would be hand-holding and helping you through the whole entire process. So from the beginning to the end, if you're applying for a program, I can help you. I will also do case consultations. I'll be working with other community members in the Northwest region that help older adults. So whether it's a municipal agent or a senior center director, we can work together to help older adults. So that's the gist of what I will be working on with family members and older adults.
作为服务引导员呢 ，Paula 将她的主要的工作时间呢，主要是将分配在用于帮助家有老龄人员或者是老龄人员本身申请 Medicaid Husky C 等这方面的援助，还有呢可以进行提供住房方面的咨询如果你有任何问题呢，可以可以和 Paula 预约，然后 Paula 会和你进行面谈，然后一步一步的引领你完成这个过程。还有呢 ，Paula 还会向您提供福利咨询您应该想出到的福利方面的咨询。如果你不清楚的话，有关福利方面的问题，还可以咨询他。也有包括个人每一个个案的管理和个案咨询，以及您所拥有的选择的咨询和短期支持总之呢，这个服务就是主要是支持家庭有这个需要帮助的老龄的这个人群中间。
And so the purpose of this grant is so that we are assured that clients and caregivers are able to maintain their health while gaining access to services that allow the individual to live in the least restrictive environment. But the hope is to kind of stop the triage system of passing people around. A lot of times people might call into our agency and say, well, I have questions about my SNAP benefits. And we might have to tell them you have to call the Department of Social Services. The idea is that maybe it'll be more like a one-stop shop, so that way people aren't playing ping pong between agencies.
服务引导员所提供的所有的服务呢，旨在向整个需要家里有老龄人群的整个这个人群呢，提供一个一站式的管理和服务的这方面的帮助，这样呢可以有效的减少这类人群被无限制的分流到各个的其他的服务部门，从而引起各个部门互相扯皮的局面。所以呢这个他的主要工作呢，就是能尽量的为大家提供一个一站式的服务。
So on in the chart, as you can see, under navigation, that little bubble, it says ADRC and ARPA. That's where I fall under as a service navigator. And I'm going to work closely with the National Family Caregiver Program and Respite Program. Those are two programs that offer respite to caregivers. So maybe you have a mom and dad, you've had to take a couple hours off of work to take care of them. This would be a program that might help alleviate you by having home health services set up at home. Respite is for those who are taking care of a family member with Alzheimer's and dementia, has to be diagnosed. So what I would do is if you had questions about, well, I don't know what to do, it's getting really hard to take care of my mom and my dad, we can sit down and screen you for these programs and apply for what you qualify for. With nutrition, SNAP benefits, Meals on Wheels, like I mentioned, if you qualify, and just pretty much helping you and your family, making sure, like we said towards the end of the document, is to have a healthy and environment for them and be able to gain all the access to all the services they might qualify for.
所以呢，大家在这张图上，在 navigation 这一栏下面可以看到有2个圆圈。那么Paula 呢，主要就是服务于在这个 ADRC 和 ARPA navigation 这里面在服务。它的主要的任务呢，就是接收到这些家庭里有 Alzheimer 和 dementia 病人的这种关于营养呀、医疗方面各个的需求，然后向他们引荐和推荐到一些别的其他的自主性的项目里去。
It is a new position, so I've only been doing it for 2 weeks. I don't have any examples or cases that I can talk about just yet, but I just wanted to talk to you guys so you know that I'm a resource now. My number is still the same, just my extension has changed. The phone number to reach me is 203-757-5449, and my new extension is 120. So again, 203-757-5449, and my extension is 120.
Paula 呢，刚刚在2个星期才开始这个新的职位，所以呢，现在这些就是所有他目前能提供的信息。那如果大家有任何疑问呢，可以致电他，他的电话号码是203-757-5449转120。again 这个电话号码是203-757-5449转他的分线是120。
Well, that's just the end of my presentation of introducing my role as a service navigator. I will still be doing choices with clients if I need to, but working with choices directly with SMP and just making sure that you don't have to play the guessing game when it comes to your healthcare, your environment. We're here to help you, so please reach out to us.
Paula 这个工作岗位呢，还是会继续的和 Choice 以及和这个SMP 继续合作，回答大家关于 Medicare 任何方面医疗方面的问题。所以呢，如果大家有任何的疑问请不要犹豫，赶快致电于他们。
Thank you guys for having me. I really appreciate you guys having this space and inviting us repeatedly. We do appreciate it.
Paula, you mentioned this is a new position. Is this a new position for you, or is it a new setup position for the company?
Both, actually. It's a new position. It's a grant that all the area agencies on aging just applied for. So it's never happened before. So we're kind of building the boat while we're captaining it. So we're learning. We're hoping to support each other. All the other service navigators, but also my coworkers here at the agency have been very kind to me. So while I'm learning, they're helping me as well. So it's new to me and new to all the agencies.
我们的听众可能有些朋友不是很清楚，Paula 呢，在我们这个Cheshire 这个多元文化协会里头是一位重要的负责人，他和我们在一起参加这个协会的工作，为大家为社区服务，所以呢你们会经常在我们这个协会的活动中看到他，他会不仅是介绍他的这个 Medicare 这个，而且呢是我们协会本身其他事务的一个负责人。I just mentioned your role in our association to the audience. Okay, anyone has more questions to Paula for now? Okay, you can always raise question later. Next, we will have Audrey call again. Audrey, please tell us about some fraud cases. We would like to know some real life examples so you can continue your presentation. Please, Audrey. And by the way, Audrey.
Okay.
Yeah, it was on mute. Yeah.
Right. Wonderful. All right, I'll start with a case, a very simple case where a client called me. She was Medicare was paying for an electric bed for her husband to have in the home. And she didn't have any co-insurance. So she had to pay the 20% that Medicare did not pay. And I don't know if anyone wants to translate as I go, but so she called me because the amount would change every month. And she had paid this for 2.5 years. So I told her to send me her bill. The Medicare, it wasn't a bill, but it's the Medicare notification of what they were paying. And in a little note, it said, you own this bed after 13 months. And she paid this co-payment for 2.5 years to this medical equipment company. Now, was that error? Was that fraud? It's hard to prove, but we stopped that immediately and corrected it. And she was very happy. But people don't really understand that they really have rights when it comes to their payments. And they don't sometimes read the small little print.
就是刚才他在说有一个案例，就是他的一个他的一个谈不上是客户吧，就是找他去帮助的一个人，给他看了一个自己收到这个 Medicare 的一个账单，那个账单里头呢，就是说他有一个Medicare 的，就是一个 medical 的仪器，就是他需要自己付一部分钱，然后这一部分钱他需要一直持续付很多年，那个他们看到这个现象之后呢，他们马上就把这个账单就给这个停止了，因为这就是这个病人他是不需要自己付这些钱，所以他们是能够帮助，就是你们遇到这种账单上的这种混乱的时候，他们是可以帮助我们的。
Another famous case in our office, Li Peng took the initial information. I think it was 2 pages long. It was very good and very detailed. And Paola handled a lot of it. A gentleman went to a local hospital for treatment that he had every year. And he received a bill one year for $4,600. He was shocked. He contacted our office. Paola found out, she initially handled the case, that the hospital had put in the wrong code. And Medicare had told the hospital they had put in the wrong code. And it took almost a year to get that corrected, but we got it corrected. He was very happy. We told him not to pay the bill, but we had to stay on top of it. I called the billing department, I think 4 months, for 4 months until the bill was finally cleared, but it took a year. But once we got involved, it stopped it from going to collections, for example. So.
OK， 下面一个案例呢，是丽萍把这个就是等于是接待的这个就是记录做的这个案例的这个记录，然后是 Paula 去协调的这个事情。那这个事情是怎么样呢？是一个病人去医院，大概去了一段时间医院之后，他就收到一个4600多块钱的一个账单，说他需要配这些账单。那个当他找到这个 SMP 去寻求帮助的时候呢，那 Paula 就发现，他实际上这个账单的原因就是 Medicare 的这个机构，这个还不是欺诈，还是一个是他们它里面的一个错误。这个 Medicare 的机构呢，只是这个医院去用一个就是一个代码，一个记账的代码去把他的这个治疗等于是这个代码给搞错了之后呢， 那这个他如果要是不配，就不去付这些钱的话呢，就有可能影响他的信用。那这个 S&P 介入了以后 ，Paula 把这个事情等于是圆满解决，就跟这个Medicare 这个机构，然后和 Hospital 进行协调，经过一年多的时间，他们把这个事情圆满解决。
Audrey, if I could just say something about the case. What's really important for everyone to know is that if something doesn't seem right, please do call us. This man had seen the doctor in March, and he had called us because he was getting borderline harassments of, you don't pay this, we're sending this collection. It was about $5,000. It's a big bill. Thankfully, he had the courage and the foresight to give us a call and to be patient with us. But if you pay for it, sometimes I'm not too sure if they reimburse you or if they can reimburse you. But if something doesn't seem right, please give us a call, because the way that the hospital made it seem, it was that Medicare was no longer covering it. We called Medicare and they go, nope, it was an error on their end. And like Audrey said, she had to call them several times before they fixed it. It was an error on the part of the hospital that if this man had not contacted us, and if Audrey didn't do this work, he would have been he would have paid this big, huge bill. And it gets very scary when you see those big numbers and you get phone calls and letters in the mail. And if you get freaked out, you might do something and then might not be able to get your money back.
Wow. Is there any time limit from the date of the service? Would you have to respond to this kind of issues?
So the thing about this, and when I spoke to Medicare, he called us in January of 2021, and he had gotten this service done in March. And it's usually when I spoke to Medicare, they have up to a year to pay for a service. So we were running against the time. So we were really applying pressure. And so there is a time frame or time, limit until when they will pay for it. And we were kind of running against time. That's kind of why Audrey kept calling, because soon January turned into February, February turned into March. Thankfully, for some reason or another, it was getting done, and Audrey wrapped it up in April. It's like she said, it took her 4 months. It was a lot of grueling work, but there is a time limit. So the sooner you think something's wrong, give us a call so that way we can get on top of it.
What's awful about this is that people really take advantage, especially of the elderly, who don't want their credit rating ruined or their reputation, and it scares them when they get a bill. Many just pay it because they're scared and they don't want to deal with it. This was a very big bill. So, but in many cases, I really feel people are taking it, and fraudsters kind of know this. So the one thing they use is fear. It's one of the things to make an elderly person fearful that something bad is going to happen unless they pay something.
And they also use semantics. I don't know if you remember in the case, the man had signed off on the note. There's a note that the hospital might give you a letter saying, if Medicare does not pay for this, you are responsible for this bill. And this man had always gotten the service covered. He had always signed the form because it was covered by Medicare. This time it wasn't covered by Medicare. And now they're saying, well, you signed this paper and you said you're responsible, so start paying up. So sometimes they use things that are legally binding, right? Because there is a form that if Medicare doesn't cover a certain service, you are responsible for the bill. But Medicare did cover it, so.
就是针对这个案例呢，那个 Paula 刚才就是提醒大家，就是说，当初这个病人去跟 S&P 去接触 S&P 的时候呢，那个他已经有3个月的时间，就是 这个账单已经晚了，迟交了，然后这个医院呢是会找这个 collection， 就是要债公司去再向他催债，跟他说这个如果你是不交这个钱的话呢，你就很多事情会发生，就会影响他的这个信誉。那好多这个老人就是因为害怕他们自己的信誉被搞坏，然后所以他们呢，就是很多人他就直接就把这个账单就付了，就是耳根清净了事儿。但是呢，其实呢，这个他们就是说，他说很多这个欺诈也是利用人的这个恐惧心理。当你自己弄不清楚是怎么回事的时候，有些时候甚至是一些合法的，利用你曾经签署过的合法的一些文件。他们可以说就是你是从法律上你是必须得把这笔钱付给我们，但是呢，那个因为这个 Medicare 就是不会去帮你付这笔钱，但实际上呢 ，Medicare 实际上是应该帮你付这笔钱的，但是因为医院和这个 Medicare 是两个机构，所以他们之间那个是没有一个就是合作关系。所以就是说，如果碰上这种情况，你们要尽早的去跟 SMP 去联系，这样的话，他们能够及时的给你们提供帮助。因为呢，Medicare 的解决这个纠纷的时间大概有1年左右，所以尽快碰到问题，尽快去寻求帮助。
I want to mention one very important case where if you give out your Medicare number, the many different ways that fraudsters can scam Medicare. One very, in the last few years, common fraud is genetic testing scams that will convince people to have a quote, free genetic tests that Medicare will pay for. One, they get your Medicare number from you. So they bill Medicare $7,000, $10,000. Two, they get your Medicare number. They can sell it on the dark internet. So criminals can use it to bill Medicare for other things. Three, they'll send you a copay. People will call me and say, I have $1,000 copay. And I said, you don't have to pay a criminal a copay. It's a fraud. And four, I've even heard that pharmaceutical companies are buying up DNA for testing. So if you've given a cheek swab, you don't know where it's going. So never, ever respond to these genetic testing fraud scams. They're costing hundreds and hundreds of billions of dollars. And criminals can monetize that Medicare card number many, many different ways. And it's really hurting our healthcare system.
那这个 Audrey 呢就在提醒，就是有好多像一些就是提供就是说就是一些欺诈者，就是说给你提供免费的这个比如说基因的测试，或者是一些什么其他的一些免费的测试，他们说这是Medicare 是会帮你付的。那有些的确是 Medicare 是会帮你付，但是呢，他们通过这种方式得到你的Medicare 的这个保险号码以后，他就可以向这个 Medicare 去要钱。有些时候呢，他甚至会让你去分担一部分这个就是这种测试的费用。然后那个那像整个现在 Medicare 这个 system 呢，可能就是会因此受到很大的一些冲击。所以就是如果碰到这种免费的这种免费的这种Medicare 服务呢，一定要小心甄别。
Okay, I put in the survey again, so don't forget to just respond and comment on what you think what we did. So, and if anyone has any questions, Paola and I are happy to answer anything.
请大家我们还有几分钟时间，请大家继续提问。总之，我们是应当保持一个警惕啊，对于这个现在非常多的这些跟 Medicare 有关的这些犯罪活动，我们要保持警惕。另外呢，由于这个系统非常复杂、非常庞大，也会有一些各种各样的错误发生。所以呢，我们今天有这样一个非常好的机会，我们知道如果有问题的话呢，去找谁？If we have any issues, concerns, questions, doubts, we would try to get help from SMP. And today we thank you.
Yeah.
And I guess there's one more question. No?
I see one person raised his hand. I guess that person has a question. ZZ has a question.
I think they're on mute.
Okay.
Yeah.
Okay, I have a question. If you apply for the Medicare in one state and several years later you move into another state, have anything changed?
If you want, I can take the question, Audrey. So Medicare is a federal program. So if you move to state, you don't have to really reapply or transfer over anything. Now, if you have a Medicare Advantage plan and you're moving out of the service area, then you do have to find a replacement Medicare Advantage plan or even a supplemental insurance plan. But your Medicare coverage should not cease to exist because you move to a different state.
So I don't do anything if you moved, right?
No, so once you move officially, it depends on what you have. If you have original Medicare, then what you would keep using it. You don't have to do anything. If you have a Medicare Advantage plan, then you'll have to, if you want to continue with another Medicare Advantage plan, you'll have to find a new one, and then you would give us a call. And the same with prescription drug plan. There are certain parts of your Medicare package that you'll have to switch, like your medication plan, but your actual Medicare, you don't have to transfer over. That stays regardless of the state that you live in. And Medicare Part A and Part B. That's what I should have said.
Yeah, the other thing is if you're in one of the federal Medicare savings programs, Connecticut has a very generous Medicare savings program. It's a federal program, but administered by the state. But that program varies state to state. So if you move to a state that's not as generous as Connecticut, they have different income levels. If you're on the Medicare savings program, you will probably be impacted based on the new state you move to. You'd have to find out what their criteria is in that state. Correct, Paola? Yeah.
Yes.
Oh, okay, thank you.
I'm curious about one question. Do those people who committed fraud, do they usually get caught?
If you go, I showed you the website of SMP. They have a lot of the cases. The cases I report to Washington, they can see, is this one or two bad events by one doctor or one company or whatever? Or is it happening thousands of times? We don't get a pat on the back. We hear about it in the news when the FBI and the Department of Justice arrest someone in the news. So if you go to the website, you will actually see the cases reported where they've caught all these criminals. It's the Department of Justice who actually enforces, the fraud against Medicare. And the FBI conducts, and there's been some in Connecticut. A psychologist, a woman, billed Medicare for millions of dollars. She was meeting in groups of 30 and 40 people, but she was billing Medicare individually per person. And she was arrested and sent to prison in Connecticut. So yes, we do.
Good to know. Yeah, that helps. Okay, we are on top of the hour, and please, everyone in the audience, please click the link of this survey, and you don't have to fill it now, but keep this link so you can fill it after our seminar.
And I have a YouTube video link that I sent to Li Ping if anybody wants to watch in Mandarin more information about the program.
Wow, yeah, I just clicked it. It's about, yeah, 全是中文的，也是这个话题，大家不妨看一看，这个可能看完了以后就会更清楚一点。
对 ，Audrey 强烈建议大家完全观看这个视频。这个视频可以说不但涵盖了他今天所涵盖的内容，可能还有更多的关于 Medicare 欺诈的内容提供给大家，更详细、更系统一下。所以 Audrey 在开会之前已经强烈建议大家去观看这个他们的公益影片。
请这个会上的这些朋友先把这个 link 留下来，可以先 click 一下，因为我们关了这个 presentation 以后，可能关了这个 Zoom meeting 以后，可能就看不到这个 link 了，就不太方便了。请问大家还有没有更多的问题？我们现在已经时间已经到了，可以，如果没有问题的话，那我们就在这里到此为止。其他的主持人没有问题吧？我们这就到此为止。Okay, thank you, Audrey. Thank you, Paula.
Thank you
for your great presentations, and we received many very important information and knowledge. We will use all this information, and I believe it benefits all of us. Thank you again, and have a wonderful weekend.
Yep. Stay cool.
Thank you. Thank you, Audrey.
Right.
Thank you, everybody. Bye.